Hi everybody, my name is Rachel, and alongside Amber, Breanna, Joy, and Kylie, we'll be narrating a presentation on the prevention and treatment of eating disorders, specifically through the Westin Act of 2015. Nancy started our interview with a story. So a young girl was walking along a beach upon which thousands of starfish had been washed up during a terrible storm. When she came to each starfish, she would pick it up and throw it back into the ocean. People watched her with amusement. She had been doing this for some time when a man approached her and said, "Little girl, why are you doing this? Just look at this beach. You can't save all these starfish. You can't even begin to make a difference." The girl seemed crushed, suddenly deflated. But after a few moments, she bent down, picked up another starfish, and hurled it as far as she could into the ocean. Then she looked up at the man and replied, "Well, I made a difference with that one." As we learned in our policy paper, the problem of eating disorders is formidable and far from a solution, but through efforts, with one person at a time, we can begin to make a difference. Through exploring the social conditions of eating disorders, the Westin Act, and an interview with Nancy Stacer, we found that the Westin Act of 2015 is an important first step to address the prevention, intervention, and treatment of eating disorders. Work still needs to be done on spreading awareness of this federal policy, as well as its implementation. So let's dive in.
When looking at different eating disorders, it's important to know how they're defined. And on this slide, we're going to talk about how the DSM-5 defines 4 different types of eating disorders. So they can take multiple forms. The first one is anorexia nervosa, which is defined as the restriction of energy or calorie intake leading to significantly low body weight, driven by intense fear of gaining weight or persistent behavior that interferes with weight gain. There's also bulimia nervosa, and that's defined as recurrent episodes of binge eating, which is characterized by the sense of not feeling in control over food intake. Inappropriate behaviors are used to avoid weight gain, and that includes self-induced vomiting, use of laxatives, or fasting. The next one is binge eating disorder, and that's defined by the DSM-5 as binge episodes, which are eating for discrete time periods where one feels out of control, characterized by eating rapidly, beyond sense of fullness, shame and embarrassment, and sense of disgust towards self. Then the last one is unspecified disorders, and that includes having eating disorder symptoms that clinically impair functioning. So you may be wondering, how prevalent are eating disorders exactly? How many people suffer from them? Is it very common? What age groups? Well, the answer is eating disorders affect people from all races, ethnicities, ages, socioeconomic statuses, and gender. Actually, 24 to 30 million people in the U.S. suffer from eating disorders. Every 62 minutes, someone dies as a direct result of eating disorders. Eating disorders have the highest mortality rate of any mental illness. You may be wondering, what are the causes of all of this? Well, there's genetics, environmental factors, personality traits that all contribute to eating disorders. However, social media plays a big role in this. Many adolescents experience dissatisfaction with their bodies in relation to media exposure. So you may be wondering, why are eating disorders so prevalent in our society? What are some of the consequences of this social need and condition? Well, for the first part, people are not being properly treated for eating disorders. There are many gaps that still exist in insurance companies' coverage of mental health needs. Insurance for eating disorders often do not cover combined mental health and physical health needs. Lack of coverage for varying levels of treatment and lack of long-term coverage is also an issue. Lack of proper education prevention in school is another issue. There's a study conducted by Green and Venta in 2018 where they found that only 29% of the students were exposed to any eating disorder programming, and no students reported exposure to prevention programming. Also, you may be wondering, why aren't the physicians maybe noticing some of the signs? While physicians primarily focus on numerical cues such as weight and BMI, and they have a lack of recognition that eating disorders are not a one-size-fits-all diagnosis. They can come in with different weights, gender, ages, and socioeconomic statuses. Psychological consequences include a stigma and shame. This is associated with eating disorders, fear of loss of control, lack of recognition of eating disorders based on the cultural norm and usually what society is telling us. Eating disorders are often associated with substance abuse, depression, anxiety, and suicide.
The Anna Westin Act was created by Anna Westin's parents in response to her heartbreaking case. Anna Westin was 16 years old when she was diagnosed with anorexia nervosa. The diagnosis completely caught her parents off guard, and the lack of information about treatment options left them feeling lost. At 16, Anna did receive outpatient treatment and appeared to be in recovery. However, when she was a sophomore in college, Anna relapsed. Her parents took her to her doctor, who told the family Anna needed inpatient level of care. However, her insurance company denied coverage for her treatment, and she was discharged home. After a long battle with her eating disorder, Anna died by suicide on February 17, 2000. Since Anna's passing, her parents have worked to develop the Anna Westin Act, as well as other initiatives to promote awareness of eating disorders, reduce the stigma, and try to ensure that no one in need is denied treatment.
15 years after Anna's untimely death, the Anna Westin Act was written into law. The act is a federal policy and was written to help those affected by eating disorders get proper care by focusing on parity and training. In this context, parity refers to mental health parity. The goal of mental health parity law is to equalize the disparities between physical and mental health insurance coverage, but more on that later. The Anna Westin Act aimed to increase training for health professionals and school personnel so that there would be earlier identification and intervention in the healthcare and school settings. The Act noted the necessity for PSAs on the reality of eating disorders and requested truth in advertising by asking for a study and follow-up report of photoshopped images of people as it relates to fair advertising practices. Finally, the Act attempted to clarify treatment coverage under the Mental Health Parity and Addiction Equity Act, or the MHP-AEA of 2008. Clarification was needed and still is needed to address the scope of the MHP-AEA provisions. Historically, the MHP-AEA only extended to insurers who were already covering mental health benefits. This means an insurer could choose not to cover mental health benefits and be exempt from mental health parity provisions altogether. The Affordable Care Act of 2010 widened the scope to include group health insurance plans to try and prohibit unequal financial or coverage restrictions on mental health care. For example, higher deductibles and copays, the caps on the number of doctor visits, or the length of hospital stays. Eating disorders were not mentioned in earlier mental health parity laws, and the Anna Westin Act of 2015 helped draw attention to this issue, in addition to the fact that mental health benefits are or have historically been more restrictive and not as broadly covered as physical illnesses, resulting in insurance discrimination. The short video at the bottom of the slide provides a brief overview of the Anna Westin Act. Now we'll take a look at the policy framework as a whole. As mentioned on the previous slide, the goals of the policy are to provide increased training to both education and healthcare professionals, to create a more informed public on the nature of eating disorders, to clarify and increase insurance coverage for those with eating disorders, and to move towards increased truth in advertising as it relates to body image. Services provided include a revised Body-Wise handbook to be made available to the public to better educate nonprofits and educational institutions on eating disorders. The benefits provided include the administration of grants, largely focusing on the identification, intervention, and prevention across a variety of disciplines, again focused on healthcare and educational settings. In the health setting, this means an updated physician curriculum. In schools, this will look more like educational seminars. Another benefit includes PSAs mentioned previously that will educate the public on varying types of eating disorders, their severity and comorbidity of eating disorders with other mental health issues, and the overall goals of identification, intervention, and prevention, with attention on the effects of bullying and discrimination, as well as the media's impact on body image. The most tangible benefit surrounds mental health parity amendments to increase access to services, specifically eating disorder residential treatment services. FTC will submit a report of recommendations for reducing ads in which human bodies and faces have been altered for advertising purposes. Eligibility mainly hinges on the entity to receive the grant. Eligible entities include any institution within a state territory with an educational institution, either public or private. Services are delivered and coordinated with the Health and Human Services Administration, acting through the Substance Abuse and Mental Health Administration, the Secretary of Education, the National Institute of Mental Health, and the Federal Trade Commission. No additional federal funds are authorized for this act. The act is carried out with funds already made available for mental health purposes and is designed to have a 0 CVE score, meaning there is no congressional cost.
On October 18th, we interviewed Nancy Stacer, LCSW and CEDS Certified Eating Disorder Specialist. Nancy has worked at Montecatini treating eating disorders for over 10 years and has a tremendous amount of knowledge in this field. Montecatini Eating Disorder Treatment Center is located in Carlsbad, California, in North County, San Diego. It offers treatment for eating disorders and co-occurring diagnoses. Monocattini offers residential, partial hospitalization, and intensive outpatient levels of care and is one of the only treatment centers where patients keep the same treatment team as they transition to each level of care. Monocattini treats all types of eating disorders, including anorexia nervosa, bulimia nervosa, and binge eating disorder. Patients attend group therapy, individual therapy, dietary counseling, and receive medical and psychiatric treatment.
We were curious about what Nancy believed to be the causes of eating disorders. One thing Nancy said was that many of their patients learned about eating disorders themselves from their very health class at school. She also stated that 75 to 85% of eating disorders start with dieting. We are born with a loaded gun, meaning genetics, and the environment, such as one that promotes a body image which is unrealistic through social media, which promotes comparison, is the trigger. Eating disorders are often caused, as well, by having a desire for control, acceptance, and black and white thinking. Rather than working on one's self-esteem, eating disorders, quote, offer these people a tangible way to achieve what they believe will get them what they want. One thing I was personally curious about is whether eating disorders are a, quote, first world problem. Do you have to be privileged to have an eating disorder? To this, Nancy cited the Fijian study, which shows that after American culture was introduced to the island, negative perceptions of body image were off the charts. So to this question, I guess I'd say yes. First world cultural perceptions of weight, being that a smaller figure is often praised, is a cause of eating disorders. When we recover from eating disorders, it often means that we put on weight, getting to a more healthy size. This is usually viewed not as positively as, say, one recovering from substance abuse, having quit substances. This is a very tough thing to face, and may prevent those suffering with eating disorders from pursuing treatment.
Monocattini is a for-profit treatment center that accepts most major insurance plans. In fact, around 98 to 99% of patients are privately insured. Monocattini does not accept Medi-Cal or Medicare, and the out-of-pocket cost for private payers is upwards of $1,500 per day for residential treatment. Therefore, private insurance is a necessity for most people to get eating disorder treatment. Only about 5% of those with eating disorders seek treatment. This could be due to general lack of knowledge and awareness of what eating disorders are and the seriousness of them. Nancy also shared how there is often a lack of understanding on what insurance plans will and will not cover. Also, even if a patient has private insurance that covers treatment, they often first have to pay a large deductible, which could be in the thousands. Once patients get into treatment, managed care plays a large role in their length of stay and what care they receive. While at times this can be a positive in that the client receives more input on their care, often the insurance company involvement is a negative. Insurance companies often do not understand the pervasiveness of eating disorders and the length of time clients need in treatment to actually recover. Insurance companies often deny coverage at higher levels of care, forcing patients to step down to lower levels or outpatient before they are ready, just as in Anna Westin's case when her insurance company denied coverage for inpatient treatment. Because treatment is so expensive, if insurance companies deny coverage, it is nearly impossible for patients to get the care they need. Finally, if a client gets all the way through higher levels of care, it is still difficult to find an outpatient individual therapist specializing in eating disorders who takes insurance at all, and still harder to find a provider that takes state-funded insurance. Clients are also recommended to continue seeing a registered dietitian, and these providers rarely accept any form of insurance. We learned a lot about what a privilege it is to receive eating disorder treatment at any level of care. It shows how needed the Anna Westin Act and additional policy is to try and make sure that care is more accessible for everyone at every level of care.
In our interview with Nancy, she also talked about the lack of awareness of health professionals. She talks about how doctors or professionals tend to have one way of viewing eating disorders. She says doctors often have a low understanding, judging health by BMI number. What is missing is how to approach this topic with patients, particularly with cultural sensitivity. She also talks about how doctors don't see or recognize when a patient needs a higher level of treatment for eating disorders. She says physicians often don't recognize the presence of an eating disorder. People don't have the lens to see it clearly. Unfortunately, many don't see eating disorders as something that warrants this level of treatment. We must have an integration of care. People who come in almost never just have eating disorders, Nancy said. She says she sees anxiety, depression, symptoms of bipolar disorder, and she says eating disorders are also biopsychosocial, with clinical, medical, and dietary components to treatment.
Nancy had not actually heard of the Anna Westin Act and believes it's probably not being utilized as much as it could be due to the lack of awareness of most providers and treatment centers. Monocattini does focus on outreach on its own and often provides trainings, events, and speakers at different organizations in the community. However, Monocattini has not seen any direct changes because of the Anna Westin Act.
There were some questions we considered while analyzing this policy. The first was, do the goals and objectives of the policy reflect the client's perspective? This policy was geared towards people who experience and struggle with eating disorders, as well as the client's loved ones. This act was born out of a 15-year battle to increase awareness of and to destigmatize eating disorders in general public, school system, and healthcare professional circles. It also addresses and attempts to respond to the great need for better health insurance coverage regarding eating disorder treatment. Do the services and benefits provided build upon the client's strengths? Are they offered choice of the services and benefits? We found that the Anna Westin Act enables educational, medical, public entities and insurance companies to recognize the unique situation of every client and their family, including specific diagnoses, severity level, needed treatment, and appropriate referrals. Does the eligibility criteria meet principles of social justice and equity? Yes. Making eating disorder treatment available to everyone, regardless of background, was something that this bill emphasized emphatically, and the implication helps to debunk the incorrect idea that only certain types of people experience and struggle with eating disorders. Next are culturally sensitive services provided. Is service delivery cost-effective? Well, another main goal of this policy was to provide access to treatment without excluding anyone with a certain socioeconomic status, insurance type, gender identity, age, or disability. For example, there were efforts to freely distribute information on eating disorders, public service announcements on how discrimination, bullying, and body shaming affect the development of eating disorders, as well as expanding Medicare coverage to include older adults and people with disabilities to receive eating disorder treatment. And amazingly, for all of that, this act utilizes already existing funds. Is funding sufficient and stable enough to meet the policy's goals and objectives? Could reimbursement lead to effective use of funding? As previously mentioned, this policy reports not needing any additional funding to carry out their initiatives. However, there could be a possible issue with responsibility going to the organizations to apply for government grants to give trainings, instead of training simply being implemented by the policy. As for reimbursement, it could potentially increase the amount of grants available and strengthen the implementation of the policy at the state level. Do policy goals meet the need and condition addressed? This type of legislation is the first of its kind, so naturally there's a lot to be done still. For example, Nancy, the woman we interviewed, was not even aware of the act or its benefits, and that insurance companies are still denying coverage for clients who clearly need treatment based on out-of-date criteria for medical necessity. One next step is the Nutrition Counseling Aiding Recovery for Eating Disorders, the Nutrition Care Act of 2019, to further expand nutritional care for those with Medicare who suffer from an eating disorder.
So there's a little more to the starfish story that I didn't say before. The man looked at the girl inquisitively and thought about what she had done and said. Inspired, he joined her in throwing starfish back into the sea. Soon others joined, and all the starfish were saved. The passing of the Anna Westin Act was an important step towards breaking down the stigma that keeps those suffering with eating disorders in the shadows. It helps to educate our society about eating disorders and supports those millions of Americans suffering on their journey to recovery. Anna Westin was one of those many who lost the battle to eating disorders. Hopefully, through her act and through current initiatives with eating disorders, we can save every starfish. Thank you all for listening and watching our presentation. Feel free to reach out if you have any questions or comments. We learned a lot and hope you did too.